Dr. Pan, thank you for that. But what would happen if they wouldn't be able to find somebody?
Well, again, I said it would be extremely unlikely. I mean, there's according to this, and again, according to this bill, there's 150,000 practitioners who would who have legal right to sign this form. So, and we can certainly, and I'll tell you, we have the leadership of a lot of the organizations here. They will step up, and if someone really cannot find, we'll find somebody to sign the form for them. I mean, that's not an impossible thing to have happen.
Thank you, and I appreciate your answer. Maybe I can ask Dr. Sears. Can you answer that question for me, sir?
Yes. Thank you for the button. Clearly, the biggest issue here is, can you find a doctor to sign on the bill? And I've presented evidence that 39% of pediatricians nationwide will not, and I haven't seen a study presented by the Honorable Dr. Pan stating anything besides that number. I feel that parents will not be able to enroll their kids in school because they'll have a very difficult time. And I will add, the addition of the naturopathic physicians to this only adds 200 naturopathic physicians statewide who will be able to sign. It's a very tiny additional.
Well, let me ask if somebody could answer the question. What happens if nobody signs the form? What happens to that child going to school? What happens? I just want a short answer. What happens? Yes.
They can't go to school.
Is that true?
Actually, that.
Okay, thank you. All right. The second question I have is, if I take my children to a pediatrician who won't sign, do I get billed for going there?
Okay, members of the audience,
please don't.
We will have sergeants remove people if you don't want to participate in a respectful manner.
Yeah.
The vice chair of this committee is asking questions. You have representatives up here well equipped to answer his questions. If there are further outbursts, I will ask sergeants to remove people from the hearing room. Thank you. Please proceed, Mr. Vice Chair.
Yeah, is there a tendency to, if you had to go to one or two physicians to get a signature, A, will the insurance companies cover each visit, and B, will there be a charge? I just want to understand.
Sure, no, that's certainly. So what happened is that, for example, first of all, just to be very clear that you don't need a separate visit often counseling takes place as part of a previous visit, so they could sign off a form based on that. In fact, the CHDP program covers child visits so if people of low income can get that, so they can get assistance in that way. We can, certainly I know that the professional organizations and public health officers, we can certainly work together, and you've heard many of the people testify saying that, they're willing to step up and help people find someone to sign the form. So this initial scenario you talked about, this guy, I think one's going to be very unlikely, and we have evidence to prove that. And second of all, I think that someone who needs access, we have programs in place, and we will also develop more if that's necessary to be sure that people can have access. We want these kids to go to school, and we are not taking away the parental rights to be able to make a decision. We want to be sure people have an informed decision.
Assemblymember Logue,
yes.
Mind if I add to that?
Go ahead.
I just want to point out, too, we're talking more than just your primary care physician or the NPs and PAs at that primary care physician's office. County health departments have clinics where they offer free vaccinations. There's many other opportunities for parents to go and receive this information. Again, all that they're doing is they're obtaining information on the risks and benefits of the immunization. They aren't asking for a sign-off on whether or not the child should be immunized. The parent is free to do as they choose after they receive that information.
You're saying that if I take my child to a physician and I take the paperwork with me and I'm asking them to sign off, there's going to be no charge. You guarantee that?
I would say that. No.
Go ahead, Dr.
Please.
I mean, clearly, I mean, that's, I think for many physicians, that's something that they would do. I can't speak for every single private practice, whatever, in the whole state of California. I would say that certainly we have clinics that provide low-cost CHCP program. Part of your requirement for billing for the visits that you provide counseling on the vaccine. So you've already received payment for it. You can't charge twice for that. So, I mean, certainly I think that's there's going to be access. And I think, yes.
Will the insurance companies also be able to cover this cost if that's true?
There is a code for counseling, for patient counseling, and as Dr. Pan was saying, many of these discussions occur on the office during regular well child visits. Talk about safety, bicycle helmets, safety restraints, gun lock safety, pool safety. These are the kind of things that pediatricians talk about all the time. I wanted to add in Washington State, and California's proposed bill, the bill does not prescribe what form this takes either. It could be a conversation over the phone. It could be a one-on-one conversation. It could be a video. It's up to the provider. They have to sign, yes, at one point. But it doesn't have to be a counseling one-on-one session. We're giving that, the bill leaves room for how the provider and family interact.
Okay. Well, I just want to thank you for that, and I'm not going to ask another question. I just want to say, Dr. Pan, I have the greatest respect for you, and we worked on a lot of things together, but this particular case, won't be able to support it. I feel like what's happening to California, and the reason we have so many people here today is there's a mistrust for state government, overreaching, mandating how they raise their children, and actually to the point where we are telling people what kind of light bulbs to screw in their lamps. So I think that we've overreached, and I think in this area, when you get to the point where you or we are mandating legislation that I think is going to put the parents, a physician between the parents and their child, I have to step back and ask the question, maybe we should do this for education first to see what happens. I know there's been some attempts, but I won't be able to support this bill, but I have the greatest respect for you. You know that.
Thank you.
For you.
Thank you, Vice Chair Logue. Just to do a time check, we have Mr. Mansour, followed by Ms. Mitchell, and seeing no other, and Mr. Garrick. So we'll go in that order. Mr. Mansour, the floor is yours.
Thank you. Dr. Pan, the main purpose of the bill is to inform parents?
Correct.
Okay. I'm just trying to understand, how do we know that parents lack information already? How do we know, how do we know that they aren't informed already?
Sure. Well, actually, studies have been done looking at sort of personal belief exemptions and decisions about vaccines. And certainly, while there's a group of parents, and maybe many of them are here in this audience, who have already made a decision, there are many others who are uncertain about that decision. What happens is that people certainly weigh the what they perceive as the risks and benefits of vaccination. Fortunately, because of the success of vaccination, the benefits are often not quite as apparent to parents, and also the risks in terms of the larger community, the school and the larger community, is also not as apparent until an outbreak happens. And so it's not as if the outbreaks, unfortunately, don't give you a lot of warning that they're coming, and suddenly when they break out. So you'll have a perfectly healthy child, and if you have an immunization rate that drops below 90-85%, it's not like it has to drop down to 50. If it drops below 85 or 90%, there are communities in California where it is below that. If someone travels to a different country and doesn't have to be in the middle of Africa, it could be in, England has a measles endemic now at this point because of lower vaccination rates. Someone flies back from a trip to Europe, and that's actually what happened in San Diego. They went to Switzerland, they came back, and now you suddenly have an outbreak of measles in that community. So I think that what we want to be sure is people understand, and it's not only about their own child, it's about, because they're going to school, it's about the other children in the school, as you heard from witnesses, and it's about other people in the community. There are people who cannot get vaccinated for various reasons, and so they depend on the rest of us who can get vaccinated as well. Now, someone decides still vaccine's not for them, that's fine. That's their decision. We're not telling them they can't have that decision, but they need to understand that. And we know that there are many parents, there are certainly many well-educated parents who understand that. There's many parents who don't know that and need to factor. And so we would like to be sure they factor that in their decision about vaccination.
Is there good information available on websites like the Department of Public Health or the California Medical Association on this subject?
May I? Yeah, there's some good information on California Department of Public Health, and that also links with CDC. There's other credible information that we try to get out there. And I also would just like to say that this bill does apply to a small minority of parents who choose not to vaccinate their their children. Today we've heard from the opposition. All these parents, I'm convinced, have devoted a lot of energy to educate themselves about this issue and have made their decision. It would be easy for me to talk with them and sign off on the form very quickly because I can tell they're passionate about it. They've spent the time. They've researched the issue. And this bill is not aimed at them. And this bill is not aimed at the over 97% of parents in California who do not choose the personal belief exemption. This bill is aimed at a small percentage of parents who might choose the exemption out of convenience and haven't spent the time that the opposition has to really research this issue and get credible information. And so I think it will apply to a very small percent of California parents. Thank you.
Okay, what about someone who is maybe low income or moderate income, or they don't have health insurance and they're concerned about the copay and they want to get information online? You don't want to, I mean, you want them to get the information. If they can't get it from the doctor because they're concerned about the cost, wouldn't we want them to get it from the internet?
Yeah, yes, definitely. The internet is a great place for information. Some of the difficulty is sorting out the credible information from the information that's not credible, and that's where a conversation with the healthcare provider can be useful, where they can steer the parent into a source of credible information and away from other sources that they believe is not credible.
And for low-income families, we have federally qualified health centers and community clinics that not only give vaccinations for free to children, but will be able to give this information for free as well.
And that's an important point that the doctor just made. I mean, it's more than just reading information. You're able to have a conversation and get questions answered, which I think is the valuable importance of this bill.
And my last question, I understand that everybody does not have insurance, but for those that do, isn't there normally an ongoing discussion, I mean, through pregnancy and after,
Yes.
1 year, 2 years, and that open dialogue with the doctor more than likely would exist for the, and I understand there are exceptions, but in those cases, wouldn't that dialogue already exist?
Yes, and that dialogue would exist. In fact, it's actually kind of required for your well child exam. I think the insurance company would expect that you've provided counseling on immunizations as part of that. And so for those patients, most likely it's like, okay, well, we had the discussion. I've made my decision. I know we've talked about it. Turn in sign the form and turn it in. I've decided not to vaccinate my children. I've had patients like that in my own practice.
Thank you. Thank you, Doctor.
Can I just say really quick, the research
I'm
is...
sorry, in the interest of time, we have a very long agenda ahead of us, and so this could go on till late into the night, but in the interest of time, it is now the members' opportunity to ask questions. I ask you to keep the questions short and hopefully the answers concise. Ms. Mitchell.
Thank you, Mr. Chairman. I'm thrilled to hear so many of my colleagues having concern about access to health services for low-income Californians. I hope that's consistent throughout the course of this legislative session. Really pleased to see so many people here who want to be engaged and have an engaged public policy conversation about children's health and well-being, and again, hope they continue to follow critical budget decisions we as legislators and they as Californians are going to have to face to make sure that their children continue to be healthy and thrive in the state of California. On the access issue, my question is, how do you define healthcare provider? Who can sign off?
Right.
I heard you talk about federally qualified health centers. What about the pharmacists at Rite Aid or the school nurse or who can sign off?
So currently under the bill as amended, we have basically any licensed physician, nurse practitioner, physician's assistant, or naturopathic doctor under supervision of physicians. So that's about over 150,000 licensed practitioners. Certainly, if you have school nurses, we've been looking at. It's a little more complicated there, but certainly, I mean, even as the bill as it stands, we're talking about 150,000 licensed practitioners who are able to sign the bill under this law.
So you didn't say nurses, nurse practitioners.
Nurse practitioners, right?
Nurse practitioners, but not RNs.
Right. Yeah, it's nurse practitioners.
Thank you.
And Dr. Pan, I think you would include in your list osteopathic doctors.
Yes, and osteopathic physicians. I usually think of them as
part of
it. Right.
Great.
Allopathic
Thank you.
and osteopathic physicians.
Ms. Mitchell.